Hey everyone, and welcome back. This is the second video in which I'll describe to you the various terms we use to describe skeletal structures related to one another. However, these terms that we'll be talking about in this video you can use to learn all of anatomy, and they come in handy. And once you learn these terms really well, that helps you describe structures related to one another and use all the textbooks and refer to the text because they all use this particular type of terminology. So today what we'll do is we'll talk about anterior, posterior, and medial and lateral. So I'd like to introduce this thing called anatomic position. So what you want to do is try to simulate this position for yourself. Wherever you're watching this video, feel free to pause and visualize how this is supposed to look. So all terms that we're going to talk about in this video and in subsequent videos are related to or in reference to this position. So to have anatomic position, you want to be standing upright. You want your limbs to be fully extended. So your upper limb and your lower limb fully extended. Your fingers fully extended as well. The palms are facing forward. Your forehead and your eyes are facing forward. Your knees are facing forward. Your belly button is facing forward. So in the classroom, what I like to do is have students on the very first day stand up and emulate or visualize or do this position for themselves, and they can look around the room then and see other people in this position as well. So even if you wrap your arm around your head and take your thigh and move it to the side or rotate it, you always come back and reference this particular position. So you can describe the thumb related to the pinky, the breastbone related to the ribs, all related to this particular position. So anterior is toward the front of the body. Anterior structures include the following: the ear, the eyes, the nose, the mouth, not the ear, the sternum, the six-pack muscle, which is the rectus abdominis. And so, of course, we all have six-packs, right? We just put Timbits on top of them over time. The quadriceps muscle, this is the anterior muscle of the thigh, and the knees, these are all toward the front of the body. So you're looking at the anterior surface of the cyclist here as they ride by the sea here. Anterior surface is facing you. The anterior skull is on the left, and the anterior humerus is on the right. The humerus, again, is the bone of the arm. And so you're actually seeing the arrow pointing at the greater and lesser tubercles of the humerus. And these are structures that are on the anterior side of the humerus. And so I like to use these structures as good anterior landmarks. As soon as I see them, I know right away I'm looking at the anterior humerus. Posterior is toward the back of the body. Posterior structures include the structures below the occipital bone. This is the back part of your skull. The vertebral column, commonly known as the backbone. And I'd like you to pause here and do something called palpate. Palpate is just simply the fancy way of saying touch or feel. So you can actually feel your vertebra prominens. And the vertebra prominens is the most inferior, the last cervical vertebra, and we call this C7 or cervical 7. And so to find this, to palpate this, you want to bend your head forward so that your chin close to touches your chest. And then feel at the base of your neck and feel the vertebra, the backbone that sticks out the most there. And when you find that, you are palpating your vertebra prominens or C7. And for most people, that sticks out the most. So other posterior structures include the gluteus maximus, the big muscle in the back part of our body above our thighs. Your hamstring muscle, this is the posterior muscle of our thigh. It actually flexes at the knee or pulls our lower leg toward our thigh. The Achilles tendon, this is a tendon that connects the plantar flexor muscles and allows us to perform an action called calf raises. So you're actually looking at the posterior surface of cyclists as they ride away from you on this bridge. Here are posterior structures on the skeleton. So I've referenced the structure on the left already. That is the spine of the scapula. That's a really good posterior landmark for the scapula. And then on the right, we see the median sacral crest. This is a really good posterior landmark for a bone called the sacrum, which is part of our vertebral column. Medial is toward the middle of the body. So medial structures include the following: the nose and the mouth. The trachea is right down midline, basically. This is the windpipe. And when we breathe air in, air travels our mouth to our throat and ultimately into the trachea, which is the windpipe, and allows air to ultimately travel into the lungs. The sternum is the breastbone, right down midline, or a medial structure. Rectus abdominis is mostly medial. This is our six-pack muscle that I referenced before, which we all have down there somewhere, right? So medial here, the central part, medial structures include this guy's hat. His head is medial. The life vest is covering the medial part of his body. And then let me just hint at lateral here. Where the oars are located and where his hands are, these are lateral structures. They are lateral to the structures that are right down midline. So his head covering his hat covering his head, the life vest medial, then oars and hand are lateral. But let me dive into lateral here shortly as well. So medial structures, you can see the breastbone, the sternum on the left, and then you can actually see on the right, this is the femur, and a medial structure of the femur is the head of the femur, where the arrow is pointing, and this is the part of the femur that actually attaches to the pelvis. And so the lateral part of the pelvis, or the outside of the pelvis, is attaching here to the medial part of the femur. So it's facing toward midline or toward the body. Lateral is away from the middle of the body or toward the outside. So lateral structures include the following: the ears, the thumb, and the little toe. So the thumb is lateral to the pinky, whereas the pinky is medial to the thumb, for example. If we refer back to that anatomic position, our ribs are lateral, and so we can actually say there's a lateral part of the rib. There's also a medial part of the rib. The medial part of the rib is right to the outside of our sternum, and then as we move away from the breastbone, we're finding the lateral part of our ribs. But the bulk of our ribs are lateral. Oblique muscles, these are located to the side of our six-pack muscle. These are more lateral abdominal muscles. So again, referring back to this position, the hands, where they're holding the oars, on the left in particular, these are lateral. The hand is lateral compared to the abdominal area, the torso, the head, the life vest covering the torso. So you're looking at the lateral part here of the pelvis. The lateral part of the pelvis on the left is where the femur attaches, or we could say articulates with the pelvis. And then on the right, you're looking at the lateral part of the skull. So in this particular video, we referenced anatomic position. So again, simulate that position, visualize that position for yourself, and remember that these terms relate back to this particular position. So we talked about anterior and posterior. Anterior is toward the front, posterior is toward the back of the body. Medial is toward midline, lateral is away from midline. And so I'm confident that you know these terms well, but we'll continue to use these terms as we dive into the various aspects of the skeletal system. So stay tuned. In the next video, what I'll do is I'll describe to you superior and inferior, and proximal and distal. So I'll see you in the next video. Take care until then.